Hi, everybody. This is Sarah Imig, RN IBCLC with our Community Birth Center. We are happy to be able to share a remote class for you with the essentials of lactation so we can support you to get feeding off to the best start possible. In this class, I'm going to be using some terms you may not have heard before. So I'll be using the terms nursing and breast and chest feeding. The term chest feeding recognizes that people use a variety of words when they're referring to their own bodies, and this class is designed for any person who will be helping to feed a newborn baby. So why do we have a class? We are living in a very bottle-oriented culture, and many of us have not seen a baby nursing. So this class gives us a chance to normalize lactation a little bit. And then also just to help you feel as prepared as possible. The knowledge that human milk is best for human babies that's something that's pretty widespread. Now people are really aware that babies being fed what is the biological norm for them helps them to avoid things like sickness, allergies, hospitalization, and obesity. But something that a lot of people don't know is that it's really helpful for the lactating parent as well. There's now evidence showing that lactation may lower chances of breast and ovarian cancer, diabetes, rheumatoid arthritis, lupus, high blood pressure, high cholesterol. There's really a lot of good reasons for the parent now, in addition to what we already knew for babies. So a little bit about current recommendations. Current recommendations say exclusive breast or chest feeding for the first 6 months of life. Around that time when your baby is showing some readiness, they will start to have some solid foods like baby foods around that time. And then continuing breast or chest feeding until your baby is at least a year old. After that, it's up to you and your baby how long you'd like to continue. So without further ado, let's talk a little bit first about something that I think is a really key thing. Just understanding a little bit about how lactation works. So the body is preparing during pregnancy by producing colostrum. Colostrum is the first milk. It is what we call liquid gold. It is sometimes gold in color, and it's just magical stuff. So colostrum is really rich and concentrated, full of antibodies, proteins, minerals, all the things that your baby needs to be protected as they leave the womb. So your body will start producing that sometime around 16 to 22 weeks of pregnancy. And you may or may not leak a little bit. It's okay if you do. It's okay if you don't. If you do, don't worry about running out because your body's going to keep producing it. It'll be ready for your baby at birth. So at birth, the hormones do a really big shift. And at that point, there's going to be some changes, and your body is going to really need frequent stimulation. And what I mean by that is the baby suckling, hand expression, or pumping for some people those first few days. And at that point, there's about right around days 3 to 5, typically, there's a really big increase in volume, and that's known as the milk coming in. really, it's not that the milk is coming in. The milk is already there in the form of colostrum, and it's transitioning into a more mature milk with a lot more volume to it. So after that point, it's important to really know this piece. I went to a lactation conference once and heard someone liken lactation to an ice machine. And so I like to share this in my classes because I think it's kind of useful to understand how it works. So when you have an ice machine, in order for it to make more ice, you need to remove the ice, right? So the same goes for milk. The more removal of the milk that's happening, the more the body is going to know to make more milk. So you've probably heard of it as a supply and demand system. And that's what that's about. You're going to want to aim for 8 to 12 feedings in a 24-hour period. A lot of information out there says every 2 to 3 hours, but really babies self-regulate. So you can just follow your baby's lead as long as your baby is gaining well. It really doesn't matter what the pattern looks like. The main thing is you're just watching your baby and not the clock. And just a little bit of a note on weight loss and gain. It's typical for a baby to lose somewhere around like 7 or 8% sometimes after birth in the first few days of life. That's normal, and they sometimes lose a little more or a little less, but they start gaining typically about an ounce a day until about 4 months of life after the mature milk is there. So, or I should say after the milk comes in. That's when they really start making that steady gain. So let's talk about the other piece that is really key to getting off to a good start. We're going to talk a little bit about positioning and latch. So it's really important, bear with me as I'm just getting my side of things to work. It's really important because it's going to help maintain your supply to have adequate stimulation. If the baby is not latched well, they're not going to be on very deeply, and so they're going to be they're not going to be sending the signal that your body needs. So that's a key piece. And then also for comfort for the lactating parent, it's really uncomfortable for a baby to have a very shallow latch. So that's something to be kind of looking out for, is how comfortable is the latch. If it's fairly comfortable, because some discomfort is common in the first couple of weeks, then chances are you're on the right track. And really after that, it should be just comfortable overall. And then the other piece is that it helps to make sure your baby is getting enough milk to gain well. If they're not latched deeply, chances are they are not getting as much as they could. So we're going to go through and talk about a couple of things here. Before we get into showing any pictures, I just want to mention something that is really important. Your baby, just like other mammals, has the innate ability to seek out milk and nurse. So the pictures we're going to show, they do make it look like the parent is doing all the work, and you've probably seen pictures like that before, but it's really just about getting into positions that maximize your baby's abilities. So in other words, to the breast or chest feeding parent, you can breathe a sigh of relief. It's not about you having to get it right. Everything about this is going to be kind of on the job learning as you go, and really getting to know your baby and you're going to fall into a pattern together. So let's see here. Let's show you just some pictures about a like different latch, because the first picture we're going to show you is about a good latch, and I hate to use terms like good and bad, but I do think that in this case that this is helpful for you. So the first picture, you can see signs of a good latch. The baby's mouth is opened really wide, like a big yawn. The baby's tongue is over the lower gum. Sometimes you can sort of see it, but what you're really going to see is that wide gape in the mouth, and that the lips are curled out like a fish. The chin is really close, touching the breast or chest. And the reason that's important is it's activating all these newborn receptors that tell the baby to open wide and latch. So I'm going to show you the next picture, which is going to show just how things look a little bit different than the other latch. You can kind of see in this one that the baby is kind of like facing downward a little bit. The baby's tongue is, in this case, back behind the lower gum. They're going to be doing what looks more like chomping. It might feel that way too. It's probably going to be uncomfortable for you if they're doing this. The baby's mouth is not open very wide, as you can see. The lips are kind of curled in, and the chin isn't really touching fully. You can see there's some space there between the baby and the parent. So, so let me take a look, or let's have you take a look, I should say, at our baby doll. And I can maybe explain that a little more thoroughly. So you can kind of see when I'm holding the baby doll that I'm supporting the upper back neck area, so that really helps the baby be kind of straightened out, right? So that back is straight, and really I just have like one finger supporting the head. You have more control than it looks like when you're holding back here. That really helps get your baby into a good position for feeding, because they're not going to slump forward. When they're slumped forward, their chin is going to go down. They're not going to be able to have that kind of head tipped back position that we're looking for. Think of it like you're drinking a glass of something. You're really tipping your head back, right? It's not going to be easy if you're trying to take a drink with your head down like this. So try and think of it that way. That might help. And yeah, and we would just want to make sure that we're not putting our hand back here on baby's head, because they have an instinct to kind of push back. That's going to work against you. So you want to be kind of supporting the baby here, making sure they're in really, really close, so that this whole part of the body is touching the parent. Okay, so we're going to move on, and I'm going to just show you some more pictures here. We're going to talk a little bit about different positions. So the first position that we're going to show is called laid back. And this position is really, really helpful. It can be used really anytime to try and get your newborn feeding well. If you're having any challenges, you can do this at home. In this particular diagram, you can see that the parent is really reclined to the point of pretty much laying flat. And what you can't see is probably on the other side, they have a pillow supporting their arm. What this does, and what the benefit of this is just that your baby is kind of hardwired to seek out and latch on and start nursing within that first hour after birth. So if you can imagine this person just giving birth and laying back and having their baby up on their chest, usually within that first hour, the baby is going to be searching and latching on, and they can self-latch. So really it's just about kind of guiding them and supporting them. And so that's why this position works so well. They've got all this sensory information in the front part of their body, their chin touching their tummy, their chest touching. It's going to help them find the way. So mimicking that in any position you do is really going to help a lot. So I'm going to show you with my own pillows here, just kind of a variation of that position, because the diagram has the parent laying so flat. And I want you to think about making a pillow palace. So really taking as many pillows as you want to get comfortable. And you can use whatever. Like here I have a rolled up towel. You know, some of the props, like having a nursing pillow, are great, but really it's just about whatever you've got around. So if that's like some receiving blankets or whatever, just the main key is that you want to get really comfortable, really supported, and you want to be able to lean pretty far back. So I don't have a pillow behind me, but that would be really good too. And then having your baby up here on your chest. So ideally skin to skin. That's gonna really help your baby be alert and get the sensory information needed to seek out one side or another and latch. So this is a really great position for calming and just helping your baby feed well. Okay, so let's show a more common position. I'm going to show you kind of side-by-side cradle and cross-cradle positioning. This next diagram is going to show you that the difference between cradle and cross-cradle, because a lot of people sort of just naturally gravitate to that one on the right. So cradle position, it's just kind of a natural way to hold a baby. You know, you've got the baby in the crook of your arm there. But what you're going to find with a newborn is that that's a really challenging position to get a really good, effective deep latch. And the reason is they don't have a lot of neck control right away. So that's more for when your baby gets a little older. And then you can kind of see in the cross cradle position that the parent is supporting the back of the head and neck. I'm just trying to move this over so I can see a little bit better. And then also they are well supported with a pillow underneath the baby to keep them really close and tucked in tight. And then they also have that other hand free, so they're able to position and help the baby latch on. So that is going to be a very common position that you will probably use a lot. All right, so let's move on and we'll look at the next position, side lying. So side lying is really great for getting rest. It's just a really, unfortunately, this diagram doesn't show that the parent looks very relaxed. They're kind of propped up on their elbow, and really I would be encouraging this parent to have some pillows back you know, under their head, and with their arm kind of protecting the baby from the pillow, so they could really rest into it. And you can have a pillow between your knees and a pillow behind your back. Again, thinking of that pillow palace. It's all about getting really comfortable and relaxed, so you can enjoy this time with your baby too. And the other thing I would point out about this diagram is that this baby is kind of up far, so it's unlikely that the baby would be able to get into a good head tipped back position like this. So I would have that baby scoot down a little. This can be really great for getting some rest in those early days. It is a little challenging with, let's see, I lost my page there. It is a little bit challenging with a newborn, but as they get older, it does get a little easier. Excuse me. Okay, let's take a look at the next position. So football is really helpful in for a parent that has given birth by C-section. Sometimes that's a lot more comfortable than having any pressure on that abdomen. So you can kind of see in this position, there's a lot of support underneath the baby to keep them close. Excuse me. And again, that other hand is free to sort of help with adjustments. One thing I really want to point out too is that you want to have a lot of pillows behind the parent, right? So behind you, behind your back, you want to get ready so that you're scooted forward quite a bit. And then, I don't know if you can see on my video, but you have a little bit of space, or on my screen here, you have a little bit of space for the baby's feet to kind of fit back, and otherwise they're going to be kicking off the wall or bed or couch. So you want to make sure you've got enough space back there and there's no pillows back there to get in the way. Again, we're looking for the baby to be able to look up, and that helps being able to have them really far back when they're starting. So let's move on, and there's just one more picture that I want to show of this parent that is Tandem Football nursing. So this is a great way to nurse twins. So this is just basically showing football on both sides at the same time. So for anybody who's having twins, that is one way of doing it. I also just want to say that really anything that works is good. Like I said about pillows, you don't have to have the perfect pillow. You really just need anything that you've got around. And if you're finding that you're in a position that doesn't look exactly like a diagram, but it's really comfortable, and your baby is doing some good swallowing that you hear, and your baby's satisfied and, you know, relaxed afterwards, then chances are that position is just fine. So it's okay to make it your own. So let's see here. I want to just tell you a little bit about like the pattern of feeding, because I think that sometimes this gets a little confusing when you're first starting out. So basically, I'm gonna show you too with my baby doll here. This might help. I'm gonna take my pillow, because assuming I'm sitting up and I'm doing a cross cradle position with my baby is gonna be, again, just for review, really, really close, right? Tummy to tummy, and the chin is gonna be touching the breast or chest. So I would be supporting baby back here and starting off on my right side. So what you'd be doing is you'd start the feeding on the right side, feed your baby until your baby's finished. And what that means is that your baby's gonna either let go or fall asleep. And when that happens, that means they're done. So you can take your baby and try to burp them. You could do that either sitting up with a gentle support around the chin here and just some like massage and light tapping on their back, or you can do it up over your shoulder, up here. And then you want to go to the other side and just offer it. See, once you get into position, if your baby wants to feed on the other side. So that's my left, as you can see. So your baby may or may not want to feed some more at that point. If they do, they will, when they're nice and close and tucked in and put into a good position, they will latch on. If they're done, the chances are they're going to just turn their head away, they're going to be in a deep sleep, or they'll have their lips kind of pursed. Those are signs that your baby is done. So you offer that side. If they latch on, great. If they don't, that's okay too. That means they're done. Regardless, at the next feeding, after your baby has been resting for a little bit, you're going to start on that side, right? So it went right, left to finish the feeding, start left. So hopefully that makes sense. Okay, so let's talk a little bit more about just some tips for early on and maintaining lactation. So it's recommended to avoid pacifiers and bottles for the first 4 weeks if possible. The reason is that any kind of artificial nipple is going to provide a different way for your baby to suck than they would if they're nursing. And so it can make it a little confusing for them if they are sucking on something in a different way and then going back and trying to nurse. If there's a reason that your baby needs some of your pumped milk in the beginning or at any time in that first 4 weeks, you can work with your lactation consultant on finding other ways besides the bottle. And sometimes it's needed, but you can talk to your lactation consultant about that. Also, lots of skin-to-skin time. So we touched on that a little earlier. Basically, it's just your baby down to diaper, and if you don't have a shirt on, your baby has that access to all those newborn instincts. Skin to skin does so many things for both you and your baby. Just some of the things are that the baby's temperature is regulated, regulates their blood sugar, their breathing. It helps calm them, and it really supports a healthy milk supply. So doing that a lot is going to be really important, not just in the first hours or days, but you can do it at home too. So you also want to be watching your baby for feeding cues. There's early feeding cues and late feeding cues. Catching your baby's early cues are super important because they are going to be when your baby is calm and much more grounded and centered and able to feed. If your baby is crying, that's a late feeding cue and they need to get calmed down first. So early feeding cues can look even as simple as a baby wiggling out of a nap. So just kind of starting to make some movements, chances are they're getting ready to feed. So that's a great time to get prepared and bring your baby close. Other feeding cues, they like to put their little hand in their mouth, they smack their lips, stick their tongue out. So that's the kind of things that you can be on the lookout for as you're getting to know your baby. Some discomfort is common in those first couple of weeks. It helps to put something on the nipples after feedings that is safe for babies, like lanolin or coconut oil, so that you don't have to wash it off. It's just going to provide a little bit of a barrier to protect them from drying out too much. If there are any challenges, you can definitely talk to your lactation consultant about that. Having any kind of pain that is really intense with the latch or bleeding, definitely a reason to get in touch, and or fever, that would be another reason. But again, I like to normalize that there is some discomfort, usually within the first few days. It should start to get better by the end of that first week. So what's next from here? I just want to mention that Our Community Birth Center website does have a list of local lactation consultants and other resources for pregnancy, birth, and postpartum. You can see the links in the video description for that. And Our Community Birth Center is launching lactation classes. So you can contact us at ourcommunitybirthcenter@gmail.com to schedule a class where a lactation consultant will meet with you and provide a more personalized and in-depth lactation preparation for you. The class is going to cover what we talked about a little bit more in depth. It's also going to cover lactation challenges, so sore or cracked nipples, plugged ducts, mastitis, and more. We're also going to talk about going back to work or school, pumping and milk storage. That's usually something that's on a lot of people's minds. Also, infant sleep patterns, that's a big one too, just talking about that and safe sleep for nursing infants. We're also going to cover some frequently asked questions and concerns. A very common one, for an example, is, do I have enough milk? Is there enough milk? So that's something that we'll talk about more in depth. And then taking any kind of medication or other substances while lactating. And then we also would be discussing what to expect when nursing your older baby. So maybe that baby that is getting some table foods, or your toddler. Also things like weaning, we'll cover that as well. So we hope that you'll reach out. We're here for you to support you in this time, and be well, and we hope to hear from you soon. Take care.